outline of today. We'll discuss hypertension, and then we will discuss a little bit about the stroke. So I have a case presentation. It's a real case. Okay. So we have a case presentation. This is a real case. I've seen this case. This will underscores what's the importance of hypertension. So we have Mr. F. He's a 40-year-old Filipino gentleman. He had no previous medical issues. During a routine checkup, this patient was told that he has a high blood pressure. Like many of you today, when we did the routine checkup, he didn't take it seriously. He continued drinking alcohol, smoking, eating salty, fatty food. He didn't do exercise, so basically he led a very sedentary lifestyle. Mr. F one day suddenly collapsed. He was brought to the hospital unconscious in a coma, and he was diagnosed with a stroke. The problem is this patient remained bedridden. He was unable to move for the rest of his life. He was receiving support with breathing tubes and feeding tubes. The patient stayed in the hospital for several months, developing multiple infections while he was in the hospital, and unfortunately he passed away. He ignored that he had hypertension, which is very treatable, and this was the outcome. I don't want anyone to panic. I want you to draw conclusions from this presentation, how to change your life. Okay, so why did this happen? Because he had hypertension. He did not address this issue. After we finish, please spread the knowledge. I read about the Bayanihan, which is a spirit in the Philippines that you help your neighbors carry even their stuff on your shoulder. It's a very fantastic philosophy. Please do share these knowledge with your friends. Okay, so what is hypertension? I want you to imagine that we have blood vessels. It's like pipes running through your body, delivering water. What is the water in question? It's the blood. If the pressure of this blood inside the blood vessels, the pipes, is very high, this is a hypertension. There are a lot of causes, but the end effect is that there is a huge damage on the vessels carrying the blood. Next slide. You already all know the blood pressure has two components. Maybe you've heard it. My blood pressure is 160/70, 200/100. What does it mean? Basically, we check the blood pressure during the contraction of the heart and during the relaxation. The normal blood pressure should be 120, the above number, and 80, the below number. Anything above that is hypertension. Next, please. You see, there are two problems with hypertension. You see the pipe? If the pressure inside is very high, what will happen to the pipe? It will burst, okay? The second issue is that it can affect the vessel, causing narrowing of the vessel. The first issue will lead to bleeding, internal bleeding. The second issue will lead to inefficient delivery of blood to the organs, which can lead to multi-organ failure. So, why does hypertension happen? There are multiple factors. Number one, lifestyle, genetics, environment. This includes unhealthy diet, especially salty diet, and unfortunately, Filipino diet is notoriously known to be extremely salty. Using soy sauce, and all of these lead to extremely high blood pressures. Smoking, alcohol, physical and emotional stress. I think all of you are overseas workers, so there is a lot of emotional stress on you. Aging, but again, blood pressure can happen at any age. It increases with aging, but it happens at any age. And other medical conditions. We will not discuss medical conditions. I want to focus on the hypertension due to the lifestyle, okay? So how common is hypertension? It is very common. It is the number one killer in all over the world. Now the distribution is varied across countries. I highlighted the Philippines. It's approximately 35% of the population of the Philippines has hypertension. It's considered a global average. Some other countries have higher rates, but it is considered a high in the Philippines. So, next slide. So, what should you guys be aware of? The following is all true about the Philippines, okay? You have high salt, high fat diet, unfortunately. I've seen some meals like bagoong. It's in the left upper picture. It's very salty, very fatty. Instant noodles. These are all very common cause of hypertension. Number two, Low intake of fruits, low intake of vegetables. Number 3, chronic stress related to work, related to emotions, financial, all of these can contribute to hypertension. Irregular sleep and work schedules. Some of you are nurses, they have special schedules, doing sometimes morning routines, afternoon routines, evening routines. Smoking, alcohol are all contributing to hypertension. Limited access to healthcare. Thankfully in Kuwait we don't have this issue. You can go, hypertension screening is free, management is extremely cheap, and late diagnosis. Like many patients are not aware what is hypertension. If you know what's hypertension, if you screen for hypertension, hopefully you're good. Next slide, please. There are other factors, genetic predisposition. Some families have a high rate of hypertension. Some cultural attitudes. For example, some, especially men, they say, what's hypertension? I'm fine, I don't care. With time, this will lead to the complications. Sedentary lifestyle, other many factors, but the most important thing is diet, exercise, sedentary lifestyle, and smoking and alcohol. So, next slide. What is the clinical feature or symptoms of hypertension? Anyone knows? How do we know that someone has hypertension? There is nothing that can tell you this patient has hypertension. This is why we call it the silent killer. It is killer in the sense that it will lead to several complications that we will discuss, but it has no complications. Yes, some people may have some vague headaches, some nosebleeds, but the vast majority, 95% of people, they have no symptoms. For many years, you can imagine that hypertension is cooking inside you. It's killing the vessels, it's killing the organs for many years. So how do we know that or in the vast majority of patients, how do we know that they have hypertension? Next slide. By complications. They come after many years of silent hypertension without knowing that they have hypertension, with a lot of complications. Every organ in our body can fail due to hypertension. You heard about stroke. What is stroke? Basically interrupted blood flow to the brain. This leads to weakness, sometimes leading to paralysis. Patients are bedridden, they cannot move. This can lead to inability to eat. So we put a tube inside their stomach for feeding. Inability to breathe. They need breathing, mechanical ventilation, which is basically we put tubes inside their lungs to help them breathe. Unable to talk, unable to understand, and there are a lot of complications regarding stroke. Heart attacks, the number one killer in all of the world, wherever you come from, whatever country, number one killer is heart attacks. We will all die because of a heart attack. This is normal for all humans. The problem is, instead of having a heart attack at the age of 40, we try to delay it until the age of 80. What is the number one risk factor for heart attacks? Hypertension, unfortunately. It leads to severe pain. Some of you already know what's a heart attack. It leads to severe pain. Sometimes people need a surgery, or sometimes they need what's called a PCI, so coronary angiography. Another problem, another catastrophic problem is kidney failure. The kidney is an important organ to filter the toxins from the blood. Imagine if the kidney does not work, you will not excrete all of these harmful substances from your body. You will require what is called hemodialysis. Basically going 3 to 5 times per week to the hospital for 6 to 8 hours undergoing hemodialysis. Connecting a tube to the blood, drawing all of your blood, cleaning it, and then putting it back. This is the normal function of the kidney. In these patients, they cannot do it, so they do hemodialysis. Other complications: vision loss, sudden blindness, peripheral artery disease. They cannot walk without having pain. Metabolic syndrome, diabetes, and other complications. Sexual dysfunction, unfortunately, and as well as dementia. Some people start to lose their ability to remember, and they keep forgetting. So untreated hypertension, a lot of complications. The problem: many of the population do not know what's hypertension, and therefore they do not know that they have hypertension. They are not aware that they should screen. Act today, act now, prevent complications, because hypertension is easily treatable. So how is hypertension diagnosed? As many of you today had screening. It's very simple, it's cheap. Actually, it's free. You can do it in any polyclinic. You go there, relax for 10 minutes, sit on a chair, we put a cuff on your hand, and then we measure the blood pressure. If it's elevated, we can repeat it again, or we can tell you to come on another day, or you can check it at home. Regular monitoring is important to know if you have hypertension, okay? So how do we treat hypertension? It's a multimodal management. Number one, lifestyle changes. I can give you medications, I can increase the dose of the medications, I can keep you on 6 to 7 medications, and it will not help you. Number one, lifestyle changes. If you continue to eat salty food, if you continue to have a sedentary lifestyle, if you continue to smoke or drink alcohol, medications will not help you a lot. Some people, they have hypertension, they adapt a new healthy lifestyle, they will not require any medications. Now, this is true that smokers cannot stop smoking. Let's talk realistically. Alcohol drinkers cannot stop drinking alcohol. Those who have a sedentary lifestyle will continue to have a sedentary lifestyle. Even small changes can help. Instead of smoking 2 packs of cigarettes a day, smoke 1 pack of cigarettes a day. Instead of drinking every day, drink once weekly. Instead of having completely sedentary lifestyle, have an exercise, 10 minutes walking 3 times a week. All of this will help. We have medications. They are very, very safe. They are very effective. Most people require only 1 medication. Some people require 2 medications. And these medications not only help hypertension, they have protective effects for the kidneys, for the brain, for the heart. These medications have extended the life expectancy of people all around the world. And regular follow-up. You have to regularly follow up. So how to prevent it? The best treatment is by preventing it. Don't have hypertension from the first place. My colleague will discuss with you about the dietary adjustments, but in general, we have to eat more fruits, more vegetables, reduce the salt and the processed food, maintain healthy weight, exercise regularly, manage the stress as much as possible, and check blood pressure regularly. You see this graph? This is a very important graph. The green curve is people who have hypertension and received management, either lifestyle or medications. The red curve is the people who ignored their hypertension. They did not take anything. See, after many years, those in the red had several more complications than the green ones. Why? Because they started management earlier. The earlier you start the management, the more pronounced the effect will be later in life. For example, if you have hypertension for 20 years, starting management now will not be as effective as if you had hypertension only 5 years ago. That's why we emphasize that you should start early. Starting earlier will lead to better outcomes. Okay, so we understood hypertension. Anyone has any question regarding hypertension? Okay, so we mentioned that hypertension, we mentioned the causes, how to know it, and what are the complications. I want to discuss the next thing, which is stroke. Why did I choose stroke instead of other things? Because stroke has number 1 killer is heart attacks, but stroke is the number 1 killer for your lifestyle, your quality of life. Having a heart attack, you can live with it. You'll have some chest pain from time to time, but stroke can lead people to be bedridden, dependent on other people for care. So what is a stroke? Stroke is interrupted blood to the brain. It's either because there is a block in the pipes, which is the vessels, or there is a bleeding, both of which can occur due to hypertension. We can say that stroke is a brain attack. It's common after the age of 55, but it can happen at any age. It is the leading cause of adult disability, ranging from being on a wheelchair to, in the extreme cases, being completely bedridden. Every 40 seconds, someone in the United States has a stroke. Now, I don't have a worldwide data, but United States they have a lot of metabolic syndrome, so it's representative of other countries. Every 40 seconds, someone having a stroke. Every minute during a stroke, 2 million brain cells die. The problem with stroke, if brain cells die, you will never regain them. You cannot regain them. Now, some connections can happen to ameliorate this, but you cannot gain new brain cells again. It's not like skin. Brain cells, when they die, they don't come back again. So stroke has a large impact on society. Many people, millions around the world, have stroke. It's the 5th leading cause of death, but the leading cause of disability. Treatment may reduce the effects of stroke if administered very early. I will talk about how to detect stroke and what to do, which is very important. And 80% of stroke are preventable. Why? Because most of the strokes happen because of hypertension. Prevent hypertension, you will prevent stroke. So, number 1 killer, hypertension. Other factors, smoking, high cholesterol, diabetes. You see all of these, they are the common causes of multiple diseases. Stroke, heart attacks, kidney failure, intestinal problems. So despite we are talking about hypertension and stroke today, but if you apply this new lifestyle, you'll prevent many other issues that we will not discuss today. So I brought some data from the Filipino Ministry of Health. How common do you think is stroke in the Philippines? Is it common? It is very common. Out of all of those who unfortunately passed away in the Philippines in the past 5 years, 15% of those had the problem due to stroke. 27.5% had this problem due to heart attack. There are other causes. If we combine all the causes in which hypertension is the shared cause, 70% of deaths in the Philippines was due to hypertension. 70% of those who died in the Philippines in the past 5 years died because of hypertension. Imagine if they started management earlier. What could that lead to? Okay, keep this in mind. As we said, worldwide, the prevalence of stroke is 1.3%. Out of all the world, 1.3% have stroke. In the Philippines, it's 1.6. So out of every 200 Filipinos, approximately 3 have stroke. The lifetime risk of having stroke after the age of 25 years, it's 1 in 4 adults. After the age of 25, 1 in 4 adults will develop stroke, hypertension, and ischemic heart disease. What's the important thing? They will develop it regardless of if we start medication or not. The important thing is, when will it happen? Some people will develop it at the age of 30, some people will develop it at the age of 60, some people will develop it at the age of 90. As we get older, it is expected that we have more diseases. But imagine the catastrophe of having a stroke at the age of 45 and then passing away like our patient. It's a true tragedy. This is the most important thing. How do you know that someone in front of you is having a stroke? And why is it important to know? So there is a mnemonic, it's called Be Fast. Anyone heard about Be Fast before? Okay, so if you see any of the following, call 112 in Kuwait, it's not 911, okay? So balance issues, if someone is suddenly unable to walk or having balance issues, he's falling towards one side. If there is any changes in vision, he cannot see well, he can see double vision, seeing 2 things at once. Facial drooping, in which means the face is asymmetrical. There is a problem on one side of the face. If there is any arm weakness, if he cannot speak or understand you, call 112 immediately, okay? Remember, be fast, okay? Next slide. So, what do you notice about these 2 gentlemen? Anything notoriously in the pictures? You see the gentleman on the right? His face is asymmetrical, right? And the patient on the left, his face is asymmetrical. Why did I choose these 2 pictures? The gentleman on the right, it's very obvious. You cannot miss it. The gentleman on the left, it's not very obvious. But in your family, your friends, you are accustomed to their regular face. If you see even very small deviations in someone who you're familiar with, call 112 immediately, okay? There are other causes, other features of stroke. Numbness is one of them. Confusion, suddenly the patient is unable to know where he is, what's his name, who are you? Trouble seeing, trouble walking, severe headache. You see this picture? This picture is very important, and there is when in medical school they told us that time is brain. Remember, every minute, how many brain cells die? 2 million brain cells die. Imagine if you come after 1 hour, or 2 hours, or 5 hours. The later you come, the more complications that you will have. So it's important to come as soon as possible. How if you suspect someone is having a stroke, tell them to do the following. Smile, raise both arms, and speak a simple sentence. If he is unable to do any one of them, there is a suspicion of him having a stroke, so bring him to the hospital. Okay, act fast. Every minute counts. When you bring the patient to the hospital, there is a window for stroke. If he came after 4.5 hours, the management is not very good. If he comes before 4.5 hours, the management is outstanding. The problem is there is a clot, it blocks the pipe. If he comes within 4 hours, I can give him a medication to open up the clot and he will have good function after that. If he comes after 5 hours, unfortunately the medications have limited ability. That's why I told you, be fast. It's not only a mnemonic to detect, but it's also remind you, be fast, meaning that you should come quickly. Okay, and please don't give anyone who's having a suspicion of stroke food, drinks or medicine. Don't give him anything, just bring him to the hospital. Okay, so as we mentioned, if he comes early, we can give him a clot busting drug to open the clot. If there is another type of stroke, thankfully it's rarer, but unfortunately it's more common in the Filipinos. We have noticed that it's more common in the Filipinos, which is called hemorrhage, bleeding. Suddenly the vessel bursts and there's bleeding in the brain. This is a catastrophic complication of stroke. They require brain surgery to drain all of this bleeding from their brain, and usually the outcome is not as good as the other type of stroke. Okay, so someone had a stroke, we treated him. There will remain some long-term consequences. Again, I told you, brain cells that die, they cannot be regained. We can try to help the patient to accommodate or try to help him in getting used to his new disability with physiotherapy. Physiotherapy is extremely helpful. Dietary care, my colleagues will mention it. Occupational therapy, we help them to get back to work. Speech and language therapy, because those who have stroke will have difficulty understanding and difficulty initiating talk. And swallowing care, because the muscles of swallowing are affected by stroke, unfortunately. So, why did I choose stroke? When I talked about hypertension, because it's the leading cause of disability. To prevent stroke, what should we do? How do we prevent stroke? By preventing what? Hypertension, okay? So, forget everything I told you now. Disregard everything I told you. This slide is the most important slide. If you're a medical doctor, if you're a nurse, if you're not in the medical field, this is the most important slide. If you go by this slide, hopefully the risk of developing hypertension will be lower. Number one, hypertension is a silent killer. Don't wait for symptoms. There are no symptoms. There are complications. Hypertension is a silent killer. Put this in your mind, okay? Check blood pressure regularly. I thank the Embassy of the Philippines and my colleague Luis who arranged this today. It came to my awareness that unfortunately some people today have very high blood pressures. I don't know if they knew before that they had blood pressure or they're not compliant to medications, but simple detection can lead to addressing this issue. Check your blood pressure regularly. If you can do it at home, it's better, and this will save your life. Prevention is very simple. Eat healthy, have regular exercise, avoid excessive salt. Don't avoid salt altogether, just avoid excessive salt and avoid smoking. Controlling your blood pressure today will matter a lot. It will prevent stroke tomorrow. It will prevent kidney failure tomorrow. It will prevent heart attacks tomorrow. Hypertension, you should not be panicked if you have hypertension. It is very preventable, it is very treatable, and it's very controllable. However, the complications, they are not easily treatable. One small lifestyle change can make a difference. Don't say, oh, I cannot stop smoking. Okay, if you cannot, don't stop smoking, it's up to you. But have a regular exercise and maintain a healthy diet at least. Medications work, please take it faithfully. Don't fear medications. The side effects are very minimal. If we give you a medication, it will matter a lot. They are cheap, they are very effective. Don't worry about medications. Sometimes lifestyle alone is not enough, so we require medications. Remember the fast mnemonic. If you see anyone with inability to raise his arms, speak, facial drooping, please call 112 immediately. Every second counts. I promise you, every second counts. Healthy habits are essential to protect your heart, brain, and your family and your loved ones. They care about you. Your health is your best investment. When should we start monitoring our blood pressure and receiving adequate management? When? Tomorrow? Now. This is the take-home message. From now, from today, maintain a healthy lifestyle. If you have a blood pressure that is very high, please go see a doctor to give you a medication. And according to the philosophy of Bayanihan, we should share this knowledge, inform your family members, organize a community workshop. Because again, if you don't know what is hypertension, you cannot detect hypertension, and you will never know how to prevent hypertension. Now, all of you know hypertension, right? All of you know how to prevent hypertension, right? So hopefully everyone here in this hall will today start managing his hypertension. My colleague will discuss with you how to start today by managing your diet. If you check your blood pressure and it's very high, please come to us. We are more happy than to share with you what are the best medications. Maraming salamat po. Thank you so much.
Yes, if anyone has a question for Dr. Talal, please just raise your hand and the microphone will be provided for you.
Any question?
Questions po?
Okay, may matanong kayo.
Sino pong may tanong sa atin? May clarifications? Kung may hypertension na po kayo, how to take your medications, paano pag nag-skip po kayo ng medications? Any questions po will be entertained by Dr. Talal.